Okay, so we're gonna go ahead and get started. So hello, everyone. In the name of the National Latino Behavioral Health Association and the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers, we welcome you. My name is Ana Chavez Mancias, and I am the co-director of the National Hispanic and Latino ATTC. Welcome to the webinar entitled How the American Disability Act Applies to Addiction, Recovery, and Employment with SUD Diagnosis. I will be your host for today's presentation. Next slide, please. Before we introduce our amazing presenter today, here are some brief instructions about our event. Here is the information about our grant. You will receive a copy of this presentation so you can read the content at your own convenience. Next slide, please. This session will be recorded and archived for future playback. A copy of today's presentation will also be made available. The lines will be muted through the presentation to minimize background noise. When we get to the Q&A portion of the webinar, you will have an opportunity to ask questions by clicking the Q&A box, and we will share your questions with our presenter. We will also be asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work that we do and provides us with the opportunity to improve our training efforts. A certificate of completion will be sent via email at the end of the webinar. Closed captioning is available for this event. If you need to activate your screen by clicking the live stream button at the bottom of your screen, then choose to show subtitles. Next slide, please. We would like to take a moment and reflect on the power of words and remind you that together we can use our words to create positive change. Next slide, please. Here is the TTC map with information about the Addiction Prevention and Mental Health Technology Transfer Centers. Each network is comprised of 10 regional centers and 3 national centers. The network coordinating offices, the National American Indian and Alaskan Native TTCs, and the National Hispanic and Latino TTCs. Our center has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide, please. Please allow us to introduce to you our parent organization, the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit and it's located in New Mexico with the mission to influence national behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. Next slide, please. NALBA's objective is to provide national leadership on mental health and substance abuse concerns of the Latino community. NALBA's policy priorities are selected capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of behavioral health professionals, funding for co-occurring disorders and alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. Next slide. Our team is staffed by Dr. Susie Villalobos, serving as the project director for the center, and I am working as the co-director for the National Hispanic and Latino ATTC. Next slide, please. Now it's time to introduce our amazing presenter. Dr. Ozzie Harrison is the project director and has been directed the New England ADA since 2001. She led the region's largest event, marking the 20th and 25th anniversaries of the Americans with Disabilities Act. From 2006 to 2011, she collaborated with the Center for Labor Market Studies at Northeastern University, yielding groundbreaking research methods and results in high school to college transition of students with disabilities. The impact of the Great Recession on unemployment of Americans with disabilities and the triumph of the older worker despite the Great Recession. Dr. Harrison provides ADA, addiction and recovery training throughout New England. She has presented at SAMHSA, New England Addiction Training and Technology Center, the National Association of Addiction Counselors, NAADAC, 2019 Annual Conference, Massachusetts Organization for Addiction and Recovery, MORE, and in 25 city and town meetings in Massachusetts on behalf of family support chapters of Learn to Cope. She led the ADA National Network's ADA Addiction and Recovery Committee, which has produced a fact sheet series on how the ADA addresses addiction and recovery. Dr. Harrison is known for her initiation, follow-through skills, and congeniality. Before coming to the New England ADA Center, Dr. Harrison worked with organizations such as Boston Self-Help Center, Mass General Hospital, Burns Unit, Perkins School for the Blind, Casa Esperanza, and the Institute for Community Inclusion at Children's Hospital. She earned her doctorate at Boston University School of Education in 1994. Oji is a person with a disability. Dr. Harrison, thank you for your availability to share your knowledge and your experience with us. Please feel free to start your presentation.
Oh, thank you so much, Anna, for that introduction. And I want to thank Dr. Susie Villalobos as well for the opportunity to speak with all of you today. The overall message for today, for this training, is know your civil rights, especially when you're in important situations. And when you know those rights in your life, it can help you to have the best life. For addiction counselors, the overall message today is inform those you serve that they have civil rights and let them know where to go to get information about those civil rights. And welcome everyone. I am so happy that you are here, and thank you for joining this national conversation about the ADA addiction, recovery, and employment. Today, for those of you who are new to this conversation, you have joined a national conversation about civil rights. And for the next hour or so, I'm going to do my best to explain protections under the civil rights law of the ADA and offer stories and illustrations that will illustrate those, and also take your questions at the end. But first, I work for a very exciting place, and that is the Institute for Human-Centered Design. It's a 44-year-old international education and design nonprofit in Boston, dedicated to the role of design and social equity across the spectrum of ability, age, culture, gender, and economic status. Our office is located in Boston. If any of you come to Boston sometime, I'd love to meet you there, and we'll have a cup of coffee together. The Institute has been home to the New England ADA Center since 1996. And the New England ADA Center is one of 10 centers in the country, all funded by Health and Human Services, U.S. Health and Human Services, and connected by a single 800 number. So no matter where you are in the country, if you call our 800 number, 800-949-4232, you will get the closest ADA center to you to answer your question. We all do the same thing, basically. We provide information, guidance, training, and do research on the ADA. We're not enforcers. We don't do compliance. We're educators. Okay. And now on to the ADA. The ADA is a civil rights law that ensures that people with disabilities have the same rights and opportunities as everyone else. This includes people with addiction to alcohol and those in recovery from addiction to opioids and other drugs. The ADA prohibits discrimination based on fears, stereotypes, stigma, and mistreatment of people with disabilities. Today, many people with addiction and in recovery are unaware of their civil rights under the law, and many institutions are unaware of their obligations under the ADA. The piece of the ADA that explains addiction is the most underutilized piece of the law. But the ADA is very clear. People with addiction and in recovery are people with disabilities. So how is it that addiction is a disability under the ADA? Well, let's take a look at that. In order to be considered a person with a disability under the ADA, a person must have a physical or mental impairment that substantially limits a major life activity. And an impairment can be something like bipolar disorder, diabetes, or alcohol use disorder. Or a person has a history of a physical or mental impairment, like substance use disorder, cancer, or heart disease. And a person could have an impairment and be, a person could be regarded as having an impairment, but not have an impairment. So they're perceived as having an impairment, but do not have an impairment. And a person must meet one of these three prongs to qualify as a person with a disability. So what are major life activities? If a person has to have a physical or mental impairment that substantially limits one or more major life activities, what are those activities? They're everyday activities, basically. Major life activities include caring for oneself, thinking, learning, working, breathing, sleeping, seeing, hearing, concentrating, walking, lifting, bending, and major bodily functions such as neurological and brain functions. And this is not an exhaustive list. So addiction is an impairment that substantially limits major life activities like working, learning, sleeping, eating, concentrating, caring for oneself, remembering, and it affects brain and neurological functioning. Well, have I mentioned that this is a very complicated issue? In fact, the ADA treats alcohol use disorder and substance use disorders differently. So people with alcohol use disorder have ADA protections in recovery and while using alcohol. In contrast, people with substance use disorders have ADA protections in recovery and when not engaging in the illegal use of drugs. Now I'm going to talk about this difference with various scenarios around alcohol, opioids, cocaine, and marijuana. But let's start with alcohol. Alcohol use disorder, in general, is a disability under the ADA, regardless of whether the person is in recovery or currently drinking alcohol. Now, the addiction still must substantially limit a major life activity like learning, working, sleeping, and thinking. Let's take a look at a scenario. Michael is often late for work. The third time he's late, his supervisor gives him a written warning stating that one or more late arrivals will result in termination. Michael tells his supervisor that he has an addiction to alcohol. His late arrivals are due to his drinking and he needs time off for detox and treatment. So does Michael have protections under the ADA? Yes. Michael is a person with a disability, alcohol use disorder, and the employer must grant Michael's request to get treatment unless the employer can prove that Michael's absence would cause great difficulty or expense. And the ADA refers to that as an undue hardship. Okay, now we're going to turn to substance use disorders. Substance use disorders, a person has ADA protections when that person is 1, in recovery, 2, no longer engaging in the current illegal use of drugs. So let's break this down. What does recovery mean according to the ADA? The ADA's definition of recovery is this: person is recovery from substance use disorder, has ceased engaging in the current illegal use of drugs, is participating in a supervised rehab program, or has been successfully rehabilitated. So what do we mean by the illegal use of drugs? Well, the ADA breaks it down into two parts. It's use of illegal drugs such as heroin or cocaine, or it's use of legal drugs such as opioids, but the person has no prescription, or if the person has a fraudulent prescription, or the person is using more than prescribed. Now, here's the tricky one. What does current mean? Does it mean days, weeks, months? Well, here's the ADA's definition of current illegal use of drugs. Illegal use occurred recently enough to justify a reasonable belief that a person's drug use is a real and ongoing problem. Current is not limited to the number of days or weeks, but is determined on a case-by-case basis, or what is called an individualized assessment. Okay, let's go to another scenario. We'll call this person Mariana. Mariana has been in recovery from heroin use disorder for 3 years. She applies for a job that she is qualified to do. The employer refuses to hire her because he learns about her past history. Is she protected under the ADA? Yes, Mariana is protected because she has a history of impairment, addiction to heroin. She's refrained from the use of illegal drugs for 3 years, which is a good indication that there is not an ongoing problem. So the potential employer violated the ADA when he refused to hire Mariana based on her recovery status. And we do have evidence now that we recover. 1 in 10 adults in the United States report having a substance use disorder. That's 27.5 million. And among those, nearly 75% report being in recovery, around 20.5 million. Now, recovery is real and it's happening every day. And a part of recovery process can be relapse or return to use. And I recently got a question from Vice President of a National Recovery Center. And this was based on a return to use. And here was his question. He asked, can a professional in recovery, such as a social worker, a licensed professional counselor, nurse, doctor, addiction treatment specialist, or peer coach be fired because of a recurrence or return to use at work? Well, here's the answer. If an employee is currently engaging in the illegal use of drugs at work, then that person has no protections under the employment section of the ADA and can be terminated without an employer violating the ADA. However, the employer is not required to terminate the employee under the ADA. It is the employer's choice. So the employer does not have to limit, the ADA does not limit the employer's choice to offer supportive mechanisms for recovery. And some of those supportive mechanisms for recovery are things like offering medical leave for the employee to seek treatment, offer a modified work schedule to get the necessary support, or something called a second chance agreement. And a second chance agreement is this. When an employee can be fired, an employer can choose, but it's not required under the ADA to offer a second chance agreement. And this agreement, in this agreement, the employer agrees not to terminate the employee in exchange for the employee's agreement to receive treatment and avoid further workplace problems. A violation of this agreement usually results in termination because the employee failed to meet the conditions for continued employment. Okay, so let's take a look for a second about what happens when a person becomes addicted while legally taking doctor-prescribed drugs. And we're going to use a scenario on this one. So let's say James became addicted to Percocet while taking a doctor-prescribed medication in a prescribed manner and in prescribed amounts. He wants to take a leave of absence to taper off the Percocet. Is James protected under the ADA? The answer is yes. He is protected under the ADA because James is legally using a doctor-prescribed drug. He is a person with a disability and may have rights to an accommodation, and he needs to discuss the possibility of an accommodation with his boss. Okay, and accommodations can be things like taking a leave to get treatment, adjusting one's schedule to go to a meeting? Okay, so now what we're going to do, we're going to change it up a little bit. We're going to talk about people receiving medication for opioid use disorder. Let's go to that. And I'm going to start off with the scenario here. So Julie works in an office at a daycare center. She's in recovery from opioid use disorder and is taking prescribed methadone to manage her opioid use disorder. Her boss learns about her history and tells her to get off methadone or you'll be fired. Does Julie have protections under the ADA? Yes, Julie does have protections. She has a history of opioid use disorder and is being regarded as a current user due to stigma and misunderstanding about methadone. Now, generally, individuals receiving medication for opioid use disorder are considered people with disabilities under the ADA. Okay, let's take this a step further. What if Julie's employer found out that she recently used cocaine while taking medication to treat her addiction? Would she have rights under the ADA? No. She's lost protections because she's currently engaging in the illegal use of drugs. What if Julie's employer found out that she recently used cannabis while taking her medication for her addiction? Would she have protections under the ADA? I'm going to give you a few seconds to think about this one. She would not. Because Julie would not be protected because under the ADA, cannabis in all its forms is illegal because the ADA is federal law. Even when used to treat a medical condition with a medical card or medical certificate or medical prescription, cannabis is illegal under the Americans with Disabilities Act. However, you need to check your state law because if medical cannabis is legal under state law, employers may need to consider reasonable accommodations for employees with disabilities for off-site use of medical marijuana. That's not at work, it's off-site use. However, an employee who uses or is high at work has no protections, under either federal or state law. So I'll tell you a story about a case that happened in Massachusetts. There was a woman by the name of Jennifer Barbuto, and she applied for a job at Advantage Marketing. She accepted the position, but before she started her job, she was going to be required to have a drug test. And she told the person that hired her that they will find marijuana in the results of the drug test because she has Crohn's disease and she manages her marijuana with a doctor prescribed dose of marijuana at night, and it's off-site. Employee says, fine, that's fine. So Jennifer starts her job. At the end of her first day, her immediate supervisor says to her, I'm sorry, we have to let you go. We found marijuana in your drug test results. She explained her situation. Anyway, she had to, or she didn't have to, but she did. She took her case to state court in Massachusetts, and she won the right as a person with a disability, Crohn's disease, to have a legal prescription for medical marijuana, which she used off-site, and she did get her job back. And this has been happening in several states, and I know certainly in New England, in Connecticut and Rhode Island, and a few other states across the country as well. So as you can see, a growing number of states have legalized marijuana, either recreationally or medically. And so you have to understand what your state law says, and a growing number of states are tying their state law to employment. And where marijuana is legal and where there is a prescription tying the medication to a disability, an individual analysis of that situation would need to be made by the employer. Okay. All right, now we're going to look at 3 stages of employment and how the ADA addresses addiction and recovery in these 3 stages. So we're going to look at application and interview process, after a job offer, and before starting work, and on the job. So here we go. Stage 1. During the application and interview process, the ADA prohibits all disability-related questions and medical exams, even if they are related to the job. Why? Because these questions can reveal a disability. And what are these questions? They're questions like, are you taking a prescription drug? You have a disability, illness, or condition that will prevent you from doing this job? Have you ever been treated for addiction to alcohol, opioids, or drugs? Okay, those are prohibited. Let's take a look at a scenario. Call this person Mark. He's in recovery from opioid use disorder and taking prescribed Suboxone to manage his opioid use disorder. He applies for a firefighter academy and is required to have a medical exam as part of the job application. You know by now that's a no-no. During the medical exam, the doctor asks, are you taking any prescription drugs? That's another no-no. Mark replies, yes, Suboxone. And the doctor responds, that will count against you. Does Mark have protections under the ADA? Oops, so sorry. Yes. Yes, did I skip something here? Yeah. He does, so sorry. Mark is a person with a disability and has the right to take an FDA prescribed medication for his disability. So the employer violated the ADA by requiring a medical exam and asking disability related questions that can uncover disability during the application and interview process. But here's what happened next. This is a true story. Mark and his cohort also had to go to see a psychiatrist as part of their application. And the psychiatrist asked the same question the doctor did. Are you taking any prescription drugs? And he said, yes, I am. I'm taking Suboxone. And he told his story about his shoulder surgery and becoming addicted to his painkillers and then going to the streets. And he had been in recovery for 5 years, taking Suboxone. He has a counselor, and his family will be a reference for him. And the psychiatrist said, I'm sorry, I can't recommend you for this position. And so Mark stood up basically and was on his way out the door. And he says, you know, I've done everything I can. I've aced my exams. I'm a volunteer firefighter. I'm in recovery. I'll give you any, any references I have. And he also knew that this was a violation of the ADA, and he got the courage to say that. He said, and I know that you are violating the ADA by asking me these questions. So he left that interview, and an hour later, the psychiatrist called him and said to him, forget we ever had this discussion. I will recommend you for the position. So there is the power of being able to know your rights and to be able to speak those rights, get the courage to do that in a moment that really required it. Okay, so here's some other issues that have come up with people. This one is explaining gaps in employment. And at least at some point in people's lives, they have to explain these things to people, whether or not you have a child, or you're taking care of a loved one, or you're going back to school. So the question I get typically is, can a job interviewer ask about gaps in employment? And the answer is yes. Yes, they can. It's how you answer that question. And that's what it comes down to. An applicant can say that, you know, I've had an illness and I'm recovered and I'm just very excited to get back to work. And that really should be the end of the discussion at that point. But what if an employer asks a disability-related question? We believe that the applicant should tell the truth, even though the question would be illegal. Because if the applicant does not tell the truth at this point and is caught lying, this might be cause for not hiring. So that's that part. And now we're going to move on to questions a job interviewer can ask about alcohol and illegal drugs during the job application process. So an employer can ask questions about the use of alcohol or illegal drugs. Have you ever used or do you currently use cocaine? A yes or a no answer does not reveal a disability. What they can't ask are things like how much alcohol or illegal drugs do you or did you consume? How often do you or did you drink alcohol or use heroin? Because these questions may reveal a disability and addiction. All right. We're moving on to stage 2. After a job offer, but before starting the job, an employer may require medical exams, ask disability-related questions, provided that employer does it for all individuals within that job category. They can ask about the use of alcohol and drugs. They can ask about the extent of use of alcohol and drugs. And they can ask about a diagnosis of AUD or SUD. Stage 3, on the job. Questions about the extent or frequency of alcohol or drugs must be job-related and consistent with business necessity. So for example, let's say a supervisor notices a change in behavior of one of the employees. Sees this person sleeping at the desk, hears him slurring his speech, notices that there's been a weight loss, and that productivity has been lower. The supervisor can speak with this employee about their job performance and observable behaviors. Okay, now we are going to move on a little bit to, I don't know if you remember back to the agenda, but we're going to talk a little bit about people with disabilities rights under state and local government. So people with disabilities must be able to participate in and benefit from all state and local government services, programs, and activities. For example, the courts, corrections, public education, public transportation, recreation, healthcare, social services, and voting. So here's the scenario. Tom is taking medication to treat his addiction. He appeared in family court and requested that he begin to see his kids on the weekends. The judge responded to his request by saying, "You'll see your kids when you get off Suboxone." Is Tom protected under the ADA? Yes. He has a history of addiction. Family court is regarding the use of Suboxone as though it is an illegal drug due to stigma and misunderstanding. Suboxone is a legally prescribed medication for a diagnosed disorder. And Tom's use of Suboxone cannot by itself justify a refusal to see his kids on the weekend. Right. Now, another area, correctional system. People who enter the correctional system with medications for opioid use disorders are discontinued on their medications. Are people protected under the ADA? The answer to this question is yes. The correctional system has an obligation to provide 3 medications for opioid use disorder: Suboxone, methadone, Vivitrol, to people entering with a prescription when the correctional facility has a medication dispensary. Now, currently, the Department of Justice is using the ADA to expand access to medication for opioid use disorder in the justice system. And only a few facilities have embraced one of these 3 medications: methadone, Suboxone, or Vivitrol. Let's take a look at a couple of cases the Department of Justice has. Okay, so the first one happened in Pennsylvania. Well, there have been many cases. Today, I'm just going to show you a few, and then there are resources for you to look at more. So the first one, the judge, the head judge of the whole judicial system of Pennsylvania, had ordered people to get off their medication for opioid use disorder or to limit their medication. Now, Department of Justice came in and said, that is something that you cannot do. These are people with disabilities and have a right to the medication that a doctor prescribed to them. This is a decision that a patient and a doctor makes, not a judge and a person. The second one happened in Massachusetts, where the parole board required certain parolees with SUD to take a specific form of medication for opioid use disorder as a condition of parole. And the parole board is to comply with the parolee's healthcare provider's recommended treatment. Okay. Now we're going to move on to businesses and nonprofits. And the ADA requires places of businesses and nonprofits to provide goods and services to people with disabilities, whether it's social service, healthcare, hospitals, private schools, daycare centers, hotels, movie theaters, and pharmacies. Here's an issue: recovery homes, sober homes, and halfway houses. Some recovery homes don't allow residents to use medication for opioid use disorder. The residents have protection under the ADA. They do. A person with opioid use disorder has a right to take their doctor prescribed medication. To refuse a person entry into a home based on medical prescription may be a violation of the ADA or a violation of the Fair Housing Act. If a recovery home disagrees with this, they must prove that accepting a person with medication for opioid use disorder would drastically alter the nature of their program or be an administrative burden. This is called an undue burden under the ADA. So we haven't had any, well, the closest we have come to a housing settlement agreement or suit is this one here, based in Colorado, Ready to Work. It's a nonprofit. It offers a home, work, and social services for unhoused people in Colorado. And so they discriminated against an individual with opioid use disorder by denying her admission to its program because she used a prescribed medication for her opioid use disorder. And also, there has been a suit in Virginia at Selma Medical Associates. This person who brought the suit had moved and was looking for a primary care doctor. So Selma Medical in Virginia refused to accept this new patient into the family practice after learning that he had a prescription for Suboxone. So what I want to say is these are overt blanket institutional policies discriminating against people with opioid use disorders. And for the Department of Justice, they're not hidden. They're written, they're spoken, and they're acted upon as though this is the way it is. The Department of Justice has really taken this very, very seriously. And people needing a doctor or needing housing or needing a job are also learning about their rights and taking this seriously as well. Okay, here's just a couple more things I want to say. We're really heading down the home stretch here. I want to talk a little bit about healthcare and some things that are happening in my home state, Massachusetts. So our Massachusetts U.S. Attorney's Office of Civil Rights, which is actually your state Department of Justice, and each state has an office, a U.S. Office of Civil Rights, which is an extension of our U.S. Department of Justice. They sent a letter to all nursing homes in Massachusetts, warning them not to refuse applicants with opioid use disorders. Why did they do that? Because that's what they've been doing. They have been refusing people to be patients in skilled nursing facilities if they have a prescription for Suboxone or methadone. And there have been many, many agreement settlements in New England, specifically Massachusetts, Rhode Island, Connecticut, where people who are in the hospital, and let's say they had a hip replacement, next step for them is to go to rehab. And a nurse once told me, she said, I spend, I don't know how many hours looking for a bed in a rehab for my patient, and I cannot find one because of their prescription of Suboxone or methadone. So this, again, is a violation of the ADA to turn a person away based on their prescription. It goes back again to that person is a person with a disability. Oh, right. I think that yes, okay. Healthcare continued. All right. So I have been saying for about, I don't know, 45 minutes or so, that the ADA's general rule is that a person engaging in the illegal use of drugs has no rights under the ADA. Well, there's one big exception to that. That's when a person seeks health care in an ER, emergency room, or a medical facility, and that person is intoxicated. They cannot be turned away. It is a violation of the ADA for ERs and healthcare facilities to refuse services to people who are engaging in the illegal use of drugs. So a person who has cocaine in their system must be provided healthcare services. All right, now we're heading into a summary and then some resources. People with addiction are people with disabilities under the ADA. The ADA applies to addiction to alcohol and addiction to opioids and other drugs differently, as you have seen. And the ADA protects people with disabilities from discrimination in employment and social services agencies, child welfare, the courts, prisons, jails, medical facilities, hospitals, doctor's office, skilled nursing facilities, and let's add education. There are many, many places. The ADA protects people in recovery with opioid use disorder, including those who are taking legally prescribed medication to treat their opioid use disorders. And knowing your rights can address discrimination, often identified as stigma. So I'd like to share some, what I think are some very important resources for you to be able to take a look at in the future. Okay, the number one is, you have a question about your rights or your obligations under the ADA, give us a call at our 800-949-4232 number, or email. You can email the New England ADA Center. We have a national ADA center, the ADA National Network, that's adata.org. And we have produced ADA addiction and recovery fact sheets and frequently asked questions. And these links are live for you to use. I wrote an article for the National Association for Addiction Professionals on this very topic we're talking about. And there is a really interesting article called Big Ideas, Advancing Solutions to Reduce Fatal Overdoses in the US, the ADA, and Substance Use Disorders. just a few more. I think you'll enjoy an article. It's to protect people with addiction from discrimination. The Justice Department turns to an overlooked tool, the ADA. And Equal Employment Opportunity Commission has released a technical assistance documents on opioid addiction and employment, and it's geared to healthcare providers. And the Justice Department released the ADA and opioid crisis, combating discrimination against people in treatment and recovery. And how to file a complaint. If you have a complaint, if you believe that you've been discriminated against around addiction and recovery, and say you just want to talk about this, you could call our 800 number. We can give you some guidance. But to file a complaint, an employment one, you go to the U.S. Equal Employment Opportunity Commission, EEOC. That is their filing information there. That link will lead you directly to their filing website, or you can call them and talk with them as well. And if it's more of a state and local government or businesses and nonprofits issue, whether it's healthcare or people who are incarcerated, rights, the U.S. Attorney's Office of Civil Rights, and the Department of Justice. Either one of those, all the complaints go into one big pile there. Okay, so do you have any ADA questions?
Thank you, Dr. Harrison. There are a few questions. There's let's see, there's one from Allison. She's saying, can you say anything about employers, RCOs hiring peers? One of the requirements is to be a person in recovery. Was always something we struggled with in hiring, whether or not it was appropriate to ask or not.
Okay. Well, an employer can require just about anything that they want and need in terms of an employee. So they can, sort of write anything down. Let's say, yes, we're looking for a person who's in recovery. That person has to be in recovery for 2 years, 3 years. However, that requirement needs to be very much explained and tied to the job description. So there needs to be reason why that qualification is necessary, written into the essential functions of the job. So, and it's interesting because the ADA prohibits people with disabilities discriminated against and not included or discriminated against because they're not getting a job because they're a person with a disability. This is actually sort of bringing in people with disabilities to work in a place. So is there a follow-up to that or something specific around that?
No, Dr. Harrison, that was just Allison's comment or question. There's another one from Lori. She's asking, what if a person detained in a correctional facility is diagnosed in the facility as they are experiencing withdrawals? Does the facility have to provide them with an MOUD?
Well, it's akin to what would happen if a person was diagnosed with cancer in a facility? What would happen if a person was diagnosed with diabetes in a facility? What would happen if the person had asthma, serious, almost dying asthma attack in the facility? That person is a person with a disability. And needs medical attention and needs support to get through that withdrawal. So that must be attended to under the law. You can't leave a person to suffer or die. So yeah, that would, you would have some protection under the ADA with that. And again, as a person with a disability.
Okay, let me see, there's a couple more questions. It says, how can an applicant find out if potential employer is asking the same medical disability questions to everyone?
Say that one again. How can who find
How
out?
can an applicant find out if a potential employer is asking the
Okay.
same medical or disability questions of everyone?
Wow, that's an interesting question. I really don't know, except that sometimes the employer will actually give you a booklet with the questions that they are going to ask during an exam or an interview. Sometimes that happens. I know I've actually seen that booklet. And so you know ahead of time what they are going to ask you and what they are going to do, whether or not you're going to have a drug test or whatever. But most of the time, I don't know. I don't know how you would. I'm so sorry.
Okay. William is asking, I manage a sober living house in Memphis. My residents often experience what I am now learning are illegal barriers to employment. What is their best recourse?
And what state is that?
Memphis?
In Memphis? Oh, okay, Memphis, Tennessee. Well, you could contact your state Equal Employment Opportunity Council, or you could go right to that complaint form there. That was a few slides before, U.S. Equal Employment Commission, and file a complaint. If they wanted to talk about it, they could call our 800 number and get some more information and guidance on that. You would, yeah. There's also a disability rights group, which is very good in the state of Tennessee. They could also help out.
Okay. We have another comment question. It says, if there are federal guidelines for certain jobs, for example, federal motors carriers and CDL, as long as it is fully disclosed in the job description, specifically recall needs no use within a certain number of hours. She says, is there a better way to ensure compliance?
Compliance of, I'm not sure I'm understanding your question yet. Could you rate that again, please?
Yeah, it's from Janet, and it says, if there are federal guidelines for certain jobs, for example, federal motors carriers and CDL, as long as it is fully disclosed in the job description, especially recall needs no use within a certain number of hours, is there a better way to ensure compliance?
So what comes to my mind about that question is the Department of Transportation, and they have very strict regulations about the use of opioids, and that is as a painkiller prescribed by a doctor, and that is as a form of Suboxone or methadone. They have rules against that use because they're very strict with who is driving, with the CDL, their passengers, whether it's a bus or a train, and And I'm thinking that that person is trying to get to that. And you can find those regulations about medication on the Department of Transportation's website.
Yeah, and she added, I guess, compliance and being non-discriminatory. I think that's more specific what she was asking.
Yeah.
Compliance,
Okay.
so that they are not being discriminatory, to those individuals.
Yeah. Now it depends on what, with the specifics. You have to have the, specific information. Like the ADA was really designed to address an individual situation, do an individual assessment, because everybody's different, and everybody has a different situation. I'm just trying to think off the top of my head. I would think that if you go to the Department of Transportation website, that they would have a resource there for complaints or making sure that you're not being discriminated against. This is as far as I can go right now, but I could do a little research on that and get back to the person.
Thank you, Dr. Harrison. We have another question. It says, how can we best counsel our consumers with SUD who have a CORI or a history of criminal charges as a result of their times that they were using substances?
Yeah, wow, this is a big question. Regarding the CORI and any criminal activity, and it's going to depend on a few things. So first of all, it depends on the job. What type of a job are you applying for? Second, what is their policy? And it also comes back to the individual. Okay, when was the offense? How long ago? What was the offense? The nature of the offense? And how does that interact with a job, an employment? So again, it's, people do have some blanket policies, and in some instances, those are very much warranted. In others, let's say I was applying for a job at Walmart, and I'm going to be shelving. I'm just going to be putting boxes up in shelving. And they look into my background, and yes, they do a CORI check, and I have an offense. So if you look at that job and you look at what they require, when that offense was, what was it? Does it tie into the job or not? How does it tie in? There's so many things to look at in that situation. It really requires an analysis.
Thank you, Dr. Harrison. We have, let's see, we have another question. It says, is it illegal for a mental health treatment center to deny someone using medication-supported recovery? Is it illegal for a drug treatment center to deny someone with a mental health disorder?
The question is, it may be deny them for services. So
I believe so. It sounds like that. Allison, if you can clarify that for us.
The image in my mind is that the person with the mental health issue is needing to go into recovery.
Right. So she's saying, she just clarified.
Pretty common. It's pretty common.
Night services. Yes.
Yeah. On the basis of what? This opens up many other avenues. The issue of addiction, there usually are co-disabilities, if you may, with that, whether it's mental health or spinal cord injury or traumatic brain injury. And there is truth and a great unfortunate reality right now of people with disabilities not being able to access addiction recovery centers because the centers will say that they're not equipped. to handle a person with traumatic brain injury or ADHD, or they're not accessible. So there may be violations of the ADA and those situations for sure.
Okay, thank you. Another question, if an employed person in recovery experiences a recurrence, they lose their protection under ADA? Same thing for a person engaging in harm reduction?
Well, the first part is correct. They can lose their job. However, because if they're engaging in the illegal use of drugs at work, they can lose their job, yes. But the employer does not have to make that choice. The employer can offer a second chance agreement or offer treatment, time off for treatment, or change their shifts so they can go to meetings or whatever. So the harm reduction, same as, so the last part about harm reduction.
Mm-hmm. So it's the same question, but in regards to harm reduction. So if an employed person is, in recovery, I guess, in harm reduction and experiences a recurrence, do they lose protection under the ADA?
Yes, they would lose protection if they're engaging in the illegal use of drugs. However, it's going to be up to the employer. And what we know about harm reduction, I do believe that people in harm reduction understand the science of addiction and recovery and return to use. And the ADA, unfortunately, passed in 1990, does not include the science of addiction. And for that space, for relapse, return to use to be a part of recovery.
Right. And we have a question, and I think it's going back to the question about the CORI or the criminal charges. Someone is asking, are they able to get those records sealed?
It depends on your state, what your state laws are. Yes, I mean, you can. And I'm not really sure of the specifics of the state laws, what they say. When you can, you have to really get into that. And you know what, from what I've read, because I've read a lot online, all of this stuff is online. When you can seal it, how you can seal it, why you can seal it. So I would do my best to look into that in your specific state and see if you can seal it.
Thank you, Dr. Harrison. And I think those are all the questions we have, unless anyone wants to add any additional questions at this time. Okay, it looks like we do not have any more questions. Dr. Harrison, could we go to the next slide, please?
Oh, yes.
Oh, and you know what? Hang on one second. Someone is asking if we can put the resource slide back up. But we will be sending a copy of you will have access to a copy of the slide deck. So I think we can just go ahead and move forward. Let's go ahead and move on to the next slide. Next slide, please.
That's my personal contact information.
Yes, so if we were not able to answer all your questions today, please do not hesitate to reach out to us or to our presenter, Dr. Harrison, who was kind enough to share her contact information with us. Next slide, please. Please take 5 minutes of your time to complete this survey. Your opinion is very important to us, and it helps us continue to do this work and provide these trainings. Next slide, please. We would like to share with you our contact information. Please feel free to connect with us if you have any questions or if you need further assistance. Next slide. So thank you everyone for being here today at this training. We appreciate you taking time off your busy schedules. Thank you. We will send the survey out and the link on how you can print your certificate of attendance as well. Thank you so much. Have a wonderful rest of your week, and we'll see you our next training. Thank you. Thank you, everyone.
Thank you very much.